Malaria, or jungle fever, is an infection of the blood transmitted by mosquitoes that has affected the human race on a global scale. Malaria is caused by Plasmodium, a protozoan organism, which enters the human body usually through the bite of an infected mosquito, though an exchange of blood through transfusion or sharing needles can result in passing on of the disease. The parasite then travels through the bloodstream to the body's detoxifying liver, where it reproduces. From there, the parasite spreads through the blood, attacking red blood cells. It affects oxygen-carrying red blood cells, reproduces within their walls, and then destroys the cells. There are 4 different strands of malaria that infect humans, making it more difficult for doctors to identify and treat patients. P. falciparum, one of the most common and the deadliest forms of malaria, is developing resistance to drugs. Once the person is infected, any blood exchange can spread the disease, including another mosquito bite. Symptoms of malaria can be likened with those of the flu: a high fever coming and going, nausea, chills, and general weakness. The different types of malaria bring their own symptoms. P. falciparum leads to hemolytic anemia, or the deterioration of red blood cells, kidney failure, coma, and death. To avoid spreading malaria, infected patients should in no way be involved in blood exchanges. Travelers headed to malaria-infected areas of the world should take extra precautions, but the use of mosquito repellents and nets can reduce risk. Additionally, campaigns have been formed in an attempt to wipe out malaria-carrying mosquitoes in certain areas, such as via the use of pesticides targeting these infected insects. Malaria can be treated with oral drugs, specifically Alarin or Lariam, in a hospital, but there is an increasing number of reports of P. falciparum cases where the parasite has become drug-resistant. Professional medical care should be sought out, but when utilizing home care to treat malaria, it is most important to drink fluids and stay hydrated. Treatment failures are actually fairly common. In 1947, over 15,000 cases of malaria were reported in the United States. This epidemic could unfortunately occur again, and the recurrence is becoming increasingly likely. Malaria still exists and presents a problem in many parts of the world and is only becoming more resistant to drugs. With global warming, mosquitoes are becoming able to find new homes in newly warmed climates. Should global warming continue, malaria-infected mosquitoes could certainly spread out and once again populate our country and terrorize America. The pending threat of malaria epidemic demands funding from the World Health Organization and the United Nations. Our nation has already experienced the loss of life and the detrimental effects of jungle fever, and we cannot afford to risk another outbreak. We must learn from our history. Unlike many new diseases, we are familiar with malaria and therefore cannot allow this old enemy to get the best of us a second time. With climate changes brought on by global warming, malaria will most certainly break out in America and could destroy our nation. That is, if we do not take action now and fund the organizations instated to prevent malaria's destruction.